briefly introducing myself. My name is Brian Anderson. I'm a doctoral candidate at Fortis Institute. I've been in for 4 years now. I'm currently a provisionally licensed professional counselor. I have a master's in clinical psychology and a master's in public administration. I worked for a number of years as a financial planner. I'm married. It's over 7 years. Happily married with my wife. Great wife. Just had a kid about 3 months ago. And the reason I chose this topic actually was because there's two of them. One, I've always had a hard time believing when people are in chronic pain. And working in integrated care alongside medical doctors and doing, that's my specialty of course, I came into contact with a lot of people who did, and it really challenged my bias against it. How do you really know when they're faking? How do you know if they're just looking for attention? How do you know you're going to treat them? Because sometimes some of the interventions that mental health proposes isn't exactly what they want to hear. They're accustomed to the other treatments of pain, whether it be medication or occupational therapy or physical therapy of some kind. So when you sit down with someone and say, you know, there are some other techniques that we can use in addition to that, including challenging how you perceive the pain, whether or not there's a certain activity limit that's bearable that we can discover and encourage you to engage in, or even just understanding how pain occurs can sometimes enable a person and give them enough focus and energy to try and tackle it. I will occasionally ask if there are any personal stories that people would like to share. For me, knowing that my mother was in chronic pain and struggling with believing her was a big obstacle for me. And like I mentioned, the primary reason why I chose to tackle this. So that's a little bit about me and why I chose this topic. And let's go ahead and get into the information. The most interesting thing about pain is that people don't understand that it's a very personal event. It distorts so much about your life. And if there's anyone here today that's experiencing that, you know exactly what I'm talking about. It gets in the way of your social activity. It gets in the way of your intimate relationships. It gets in the way of your hobbies. It gets in the way of you being able to hold a job. And for my mother, and I'll use her kind of as the backdrop for this, she struggled to work for a long time, did the best that she could. And I struggled, of course, with not just seeing her as being lazy or not wanting to put forth enough effort. I felt ashamed about that. And as her pain worsened from some back and hip injuries, I really had to reformulate how I thought about it. And I realized that unless I began to kind of reach out and understand that pain was a very personal event for her, that there was no progress that was going to be made. Pain obviously disrupts your life and your daily activities. And it can be the result of multiple factors. Regardless if it's something that's physical, regardless if it's something that's mental, regardless if it's something that's temporary or something that's permanent, it can disrupt things and it can be cause for multiple issues, whether it be a car wreck, whether it be even a severe emotional injury that's happened. And it doesn't make it any less real. And that's something I've always tried to stress with my patients is that, listen, I'm not so concerned with proving or disproving your pain. I could care less about that. All that I know is that it's affecting you right now, and that's why I want to help you. And sometimes that's hard for me to digest because all the information I get from other sources is, well, pain is something we need to solve. Pain is something we need to fix. But that's not always realistic, is it? Sometimes learning how to live with the pain is the best option that you have. And that's kind of what I like to focus on. So what we're going to do here is we're going to review some brief facts about pain. We're going to discuss briefly the problems associated with chronic pain. And then really at the crux of it, though, is kind of explain and practice a little bit some interventions that have been shown to help reduce pain at the mental health level. Okay? So what that means is I'm not going to be talking about different types of medication. I'm not going to be talking about different exercises per se specifically. I'm going to be talking about things that we can do individually, alone, with gauging our thoughts, gauging our emotions, that we know can control our behaviors. Some of these activities include managing thoughts, deep breathing, imagery, positive imagery, not thinking about that bad thing, keep it good, and pacing. And as I go through each one of these, I'll discuss them in more detail. Pain, as I mentioned earlier, is a very real topic, actually, and it's growing in this society. There's for a number of reasons. largely becoming more sedentary as technology increases. The demand to get out and be physically with labor isn't there as great, and so that produces less opportunity for our joints and our muscles to kind of flex themselves and continue to stay strong. That's kind of an artifact of culture. Another reason is because medication, sometimes we rely on that to manage our pain. For instance, last night I twisted my ankle playing basketball. It's happened time and time again, and I never learn. And when I hobble in, I just expect to endure the old eyes from my wife. And I thought, what can I do for this? I've got some other pain meds, especially ibuprofen or even Tylenol or something I could use to manage it. But I said, you know what? I'm just gonna lay in the tub and lift it up, and I'm just gonna concentrate on my thoughts and how I'm thinking about it and see if that works. Obviously, this isn't a chronic issue. It's a very temporary one. I'm already feeling better this morning. But pain is pretty much a real part of life, whether it be injuring our finger or having to deal with lower back pain for your entire life. It affects approximately 33% of the population. It actually accounts for 80% of all physicians. Research shows that it's actually greater for females. It can obviously intuitively increases with age. It's associated with poor socioeconomic status. Why that is, I don't know. There is a different explanation for it, whether they don't have access to physical fitness equipment. They don't have the time to exercise, but they have to work in 2 or 3 jobs. Or it's just simply not on our radar because they haven't been raised in that environment. 50% of the 33% of the population experience daily pain, and 32% of that 50 experience pain greater than 7 on a scale of 1 to 10, with 10 being the most intense pain. Lower back pain accounts for 5% of the occurrences, with 25 to 30% seeking care for that lower back pain, which is interesting. What that means is that there's a lot of people out there that are experiencing pretty intense pain that aren't getting help for it. And it consuming so much of physicians' visits suggests that it's on people's minds. But what are the reasons exactly for people choosing not to go in and get help for something that's actually, pretty bad? Another injury associated with basketball. I'm 33, and I have to realize that, I guess, is lower back pain for me. I twisted it about a year ago, and I'm still not over it. I can't figure that out. So I affiliate with the last bullet point a little bit. The gate control model of pain is really the foundation from which all of the interventions are built on. And I go over this first because what it does is it helps us understand better why we design some of the things that we do, some of the interventions. On the left-hand side of the first page of the handout that I provided, there are some examples, physical, emotional, mental, and behavioral examples that open the gate. I'm not going to go too much into the anatomy of it, but at the base of our spinal cord is what's called the dorsal root, and the way that the neurons interact with one another have been shown to be a direct reflection of our thoughts, not just our sensory receptors and the messages that get from our skin or other parts of our body, but also how we think about things. And the physical reasons for opening the gate include, obviously, the extent of the injury. The greater the injury, the more likely it's going to stay open and send messages to your brain that something's not quite right here. The readiness of the nervous system, the send pain signals, and the inappropriate activity level, like you're trying too hard to make that basket, you need to just pull back a little bit. Some of the emotional illustrations that open the pain gate are depression, worry, anxiety, tension, and anger. We've all experienced those, I would assume. And some of the mental, in terms of cognitive, are focusing on the pain, boredom due to minimal involvement in life activities, non-adaptive attitudes, and finally, some of the symptoms associated with behavioral reasons for opening the pain is just simply withdrawal from positive activities, including social interaction and poor health habits. Is anyone here struggle with chronic pain, or knowing someone closely that does, that in reflection you could see how some of these activities might be contributing a little bit, making it part of it?
all the clients that we work with.
Okay. So what kind of things do you encounter in terms of one of these 4 categories?
Mainly emotional, all of them. Yeah, I mean, they don't do much during the day.
Okay.
They suffer from depression, anxiety, withdraw from positive life activities. Like some of them barely leave their home, barely get out of bed.
It's pretty difficult to approach those, especially if you don't want to come across as patronizing or disbelieving.
Well, a lot of times they just treat it with pretty extreme pain medication. I mean, I had a client that was on 2 pain patches. And it's like, well, they would give someone dying of cancer and it was because of back pain. And so she didn't know why she couldn't do anything. But yeah, it's pretty sad.
Did anyone else share that experience? Yes?
The same. I'm with all of with girls.
So whenever you sit there and mention that they have depression, anxiety, tension even, and some of the words, I'm sure some of the phrases they use, it comes across pretty clearly that they're struggling with that emotionally. How do you respond to that? I know it's not your job, but certainly something's pulled out in you that you kind of want to help a little bit. How do you respond to that?
Well, if they're not on pain medication, I try. My big thing, what I see in people is they sit around their house all day. They don't want to get up off the couch, or those that they think they need an electronic wheelchair, And that's when I tend, once they get it, it's usually downhill all the way. I mean, you just see them, go down, and then the pain gets worse because
they're prevent it before it gets to that point.
Yeah, so I try to talk to them about not getting the mobility chair because I've just seen over the years the hips and the back, especially the lower back, and to try to get out and walk, or just even if it's just across the street and back, or just down the road and back. And then we work coping skills for it.
Trying to get them in physical therapies.
Arrange services for them.
Because usually the last thing any of us want is for them to be on pain medications because it really greatly affects their psychopaths. And
well, when they do that, I can only imagine, at least I know in my experience, it's difficult to kind of be like, man, I know where this is going to lead. I don't want to see you go down that road. When I started to experience those thoughts, I had to remind myself that it's natural for human beings to generally, not always, but generally try and take the path of least resistance. It's what kind of maintains us in life. If we were to tackle every challenge, we wouldn't be around very long. So when a patient of yours is looking for that electric wheelchair, that's usually an artifact of just what you would normally expect to happen. That for me has helped me kind of understand where they're coming from a little bit, affiliate with them a little bit more, build some trust with them, and so that my future suggestions, such as similar to what you might have offered, are more easily heard. The setting that I see people with chronic pain in is usually a primary care setting. The medical doctor knows that there is some chronic pain that's being experienced by one of his patients. If he refers that patient to us, we sit down with them and we try and see them at least 3 or 4 times, try and build a relationship, encourage them to do some of these things. And it sounds like, given the position that you're in an ideal spot to do the exact same thing, as well as take some of these suggestions, maybe hone your skills a little bit. But in addition to referring to other forms of therapy, maybe this might be on your radar now too. Maybe you want to talk to a PLPC or an LPC or a psychologist for some help about how to manage these thoughts and feelings. But I understand where you're coming from. I appreciate you sharing that. So it sounds like this is pretty real. And on the right-hand side of the table here, we have the interventions that are based on what we know opens the gate. So intuitively, we're assuming that that's going to close the gate. For instance, applying heat and cold, massage, relaxation skills, such as deep breathing that I'll be discussing. Avoiding excessive emotions, trying to concentrate on the positive emotions, managing stress. In other words, not just stress as it occurs, but learning how to avoid stress, depending on the relationship you have with your patients. And what really stresses you out in life? What really gets on get you on edge. I'm sure finances are a part of it. Maybe even pushing them in the direction of a certified financial planner or a credit counselor of kind can help relieve some of that stress, might help them. I got to throw that in, that's what I used to do. Distracting away from pain, not with the intent of diminishing the pain, but actually quite the opposite. It's because the pain is so real for you that we've got to figure out a different way to deal with it. It's not because I don't believe that you don't have it. The one that I struggle with is you just need to change your attitude about things. Because attitude is a really complex concept. You know, it's really a hodgepodge of a lot of things going on at that moment in our life. And so it's really difficult to kind of discuss how attitude can affect us without directly saying your attitude stinks. Please don't ever do that.
They sometimes want to. Right?
Regardless of how true it may or may not be.
That's what I find sometimes, if somebody's attitude is kind of geared against it, then even if you have you thought about maybe, oh, I tried that before, it didn't work. Have you tried this? It hasn't worked before, but kind of the help rejecting complainer, it's like, what do you do if they just aren't going to hear it? It's kind of somewhat up to them if they're going to adopt it.
It is very much up to them. As providers of care in one modality or another, it's really our responsibility to offer the most efficacious, best treatment for them, and it's up to them as an individual with choice to determine if they're going to accept that or not. I know that I've encountered that exact same thing when it comes to deep breathing. Well, I've tried that. I said, that's good. I'm really glad that someone is taking the time to work with you on that. Would you mind sharing with me what you remember from that, or how they went about teaching you that? Maybe there were a couple of things that threw it off kilter, wasn't making it work quite the way it was supposed to. And I always clarify that any of these procedures are not going to work only the first time you do them. This is a matter of persistence. This is a matter of taking control back from your life and away from pain. And sometimes there's the expectation in our culture, especially that when you do something, it's supposed to work right then. If I've got to wait one more second at a stoplight, I'm not happy. So right now, right here. And you see that even when we try and offer treatments. Some of the behavioral explanations for closing the pain gate: increase positive life activities. What makes you happy? What do you enjoy doing? What are some hobbies that you no longer do as a result of this? You know? Oh yeah, my daughter, my son, or my relative, or someone that I know does that. You know, striking a conversation, trying to pull it to the forefront of their mind of how important that hobby was. Appropriate exercises, healthy eating, and refraining from unhealthy habits, such as, you know, excessive smoking and drinking, and any other kinds of substances that might get in the way. Thinking is part of closing that pain gate. Some unhelpful self-talk that you probably run into a lot, or I can't stand this pain. Pain is horrible. The pain is ruining my life. I can't do anything to make it stop. Don't dispute this. Don't say, oh, no, you can manage the pain. Oh, the pain's not ruining your life. You know, don't do that. Yeah, I understand. I hear you. Definitely. It's not like it's really impacting you. Let's find some alternatives to replace that thinking. Such as, you know what, the truth is, you can stand this pain. You're standing it right now, actually. I've dealt with this before, you can get through it. And we're going to be here to help you get through it. This pain is very intense. It's on a scale of 1 to 10. But does that mean that it's horrible? It's been worse? It's certainly been better. But does that mean that it's something I need to focus on? You can just concretely and unemotionally acknowledge that the pain is there. This pain is difficult for me as opposed to ruining my life. Because that's a realistic statement. This one, not so much. This one, definitely. Pain is difficult. And if you have the expectation that pain is going to be solved, then there's the expectation that something can solve it. And when they don't get whatever that is, they get even more upset. So also kind of realigning expectations. And then finally, I can't do anything to make this stop. Well, that's not entirely true. They're meeting with you. They're at least discussing it in that moment, even if it's not always in a positive way. Perhaps they are meeting with a therapist at some time. Maybe they are seeing a physical therapist. And they are doing things to help them get through it. Of course, again, though, the expectation is to completely solve pain, then this really kind of diminishes. Some common pain beliefs. Pain is not a sign of a serious physiological disease or injury. It is real, but it doesn't necessarily indicate that there's something really intense going on all the time. If it's persistent, there are certain symptoms, of course, you might want to get that checked out. Reliving the pain by focusing on it can, in fact, make it worse. They don't want to hear that one because they think the pain can't escape them, so therefore they have no option. The truth is, there are some things that we're discovering that you can do to get away from it. Chronic pain does not mean you're broken or flawed. I certainly hope not, because I would be very broken and flawed right now. Pain is difficult, but it doesn't have to ruin your life. And this kind of comes back to building that relationship, understanding what they enjoy doing, and helping them focus during the time with you on other things that are enjoyable. Happiness can be found when in pain. No non-medical interventions recommended by a doctor does not mean they believe you are faking. I've run into that one sometimes, that whenever the medical doctor actually doesn't prescribe something, that all of a sudden they become very offended. Eliminating pain is one of many goals, maybe unrealistic. So those were some things you can do briefly to kind of challenge the thinking, and a lot of that based on the premise that you do build a relationship. I'm sure some of you see a patient coming from afar and you know how that conversation is going to end up going. And kind of preparing yourself for that and trying to exercise some of these techniques to offset their thinking patterns. Here are some emotional illustrations, kind of in line with what you were talking about. I would like to go through these, but what I will do for the sake of time actually is on the second page here is an illustration of how this works. And I'll do a couple of brief cycles for you. Deep breathing is beneficial because it's actually the way that infants breathe. I watch my 3-month-old sometimes, and I watch his diaphragm go up and down, and I kind of get giddy if this stuff is actually real. I'm like, wow, it's right, you know. So what happens with deep breathing is that it opens up, I believe, the capillaries in the lungs, the sacs in the lungs, and slowly exercises them to be more elastic, kind of grow and be able to hold more oxygen. And of course, if there's more oxygen in your body, then you're capable of thinking clear, and your body kind of operates better in general. The way that deep breathing is intended to work is, and these are not, copy-written interventions, so if you're comfortable doing it, I would suggest sitting down with your patients and trying it. Getting in a comfortable position, usually like this, like lounge back. I encourage them to put one hand on their diaphragm and the other on their chest, and let them gauge how far their diaphragm is moving above their chest. See, if their chest is moving higher than their diaphragm, then they're doing it wrong, so they need to be breathing from here. So you can kind of sit back and relax a little bit, and you breathe in for 5 seconds. You're supposed to hold it for 5, and then breathe out. And then be without breath for 5 seconds. And then repeat. Do you want to try that, or is that one of those who wants to answer the question first kind of circumstances? If not, that's perfectly fine, but I would encourage you to become familiar with that simply because practice makes perfect. I'm not really that great at it myself. I've tried it a couple times when I've been anxious. It's worked. But the more you do it, the more comfortable it becomes, not just because you get more used to it, but because it becomes part of your daily repertoire. So one thing that I do is I encourage patients experiencing chronic pain to allot a 20-minute period out of their day, maybe around noon or whenever they know they're going to be experiencing a lot of pain. And every day, try that. Maybe start off with just 5 minutes for a week, maybe go to 10 minutes, 15 minutes. How you grow their experience with them. And the reason deep breathing works is not just because of the way that it works on the body, but because it's also focusing you away from the pain. It's also taking you away perhaps from some of the activities that cause the pain. And I personally believe the biggest reason is because it gives that person a feeling that they're taking back control. They're doing something. The second thing that we can work on with patients who have chronic pain is guided imagery. That is on the page beyond the illustration of the arrows. What works for one person may not quite work for the other. Guided imagery is great. I like guided imagery as well. I like it better than deep breathing. I kind of live in a fantasy land half the time anyway. I'm that guy that's sitting at the stoplight, and I don't intend to, but I sometimes don't listen to whole conversations, and I pop in and out of them because I'm daydreaming on something. So guided imagery gives me a chance to escape and be legitimate. And what I do with my patients is I sit down and I think, what's your happy place, basically? Where would you like to be? Well, that's easy enough to answer. What the fun part comes into is when you start engaging all the sensory modalities. Would anyone like sharing with me perhaps what their happy place is? A place they would like to envision themselves being on a really stressful day?
Yeah, this a meadow with no bugs in it, and I'm just laying in the grass, and it's really soft.
So it's soft.
It's soft.
Texture.
And it's when I'm starting to smell just flowers.
What do you smell? What kind of flowers do you smell?
It's almost like cut grass. I love the smell
Okay.
of that, and just different flowers, and just the sun beating down on my face.
So you're feeling the warmth of the sun
Yeah.
on your skin.
And nobody can get to me. It's
That's funny. What do you hear when you're in that meadow?
I never really focused on that. I don't know.
Do you might hear birds or the wind rustling?
Mhm.
Right. So you engage in sensory modalities there. You smell the fresh grass. You felt the sun. You felt the texture of this grass on your skin. You essentially relive that by hearing the wind rustling, smelling the flowers, perhaps just the fresh breeze. I'm assuming it's meadow, it's probably outside of an urban area, so you're not going to get any congestion and so forth. You know, hypnosis kind of works similarly in that it hijacks your sensory modalities and it distorts how you're currently experiencing the world. And guided imagery is very much the same thing. It's purposefully hypnotizing yourself almost and getting caught up in a different place. Now, admittedly, okay, I'll be the first to say this, it's a little hokey. These are a little hokey, but they work, and that's the most important thing. And they're based off of sound science. Whenever you have that relationship with your patient, they're probably going to be more inclined to kind of share these experiences with you. You know, I've known you for about 30 minutes now, so I don't expect for you to share, although I do appreciate that. Mm-hmm. But in your own private time, think about for yourself, where would I want to escape to? What would I feel, hear, smell? What are the senses that are going on? And if you can kind of think about that on your own, it'll be easier for you to kind of suggest it to your patient whenever you meet with them. The instructions are simply to find a quiet place, become relaxed. Perhaps you could couple deep breathing with guided imagery. Clear out as many thoughts from your mind as you can. It's very tough to do sometimes. Attempt to do that as much as possible. Imagine your favorite place, real or imaginary, that you'd like to go to. Imagine that your pain or discomfort is an electric current that you can actually turn off or just allow to leave your body for that moment. Imagine that pain is something that can dissolve away, can leave you. Imagine having a conversation with your pain or disease. Pretend your pain or disease can talk, and imagine the conversation that might go between the two of you. Imagine that you feel clean water or another liquid flowing through you, or that you're a flower or the sun that you feel your petals or rays flowing in the air. Imagine you find a key and then a door that enters a room where you can leave all your pain and discomfort. And whatever you're doing, attempt to experience those senses. It's experiencing the senses that will really make it come alive for you. Does anyone have any questions about how this works? I would assume perhaps that some of you have been exposed to this before or heard of it. Okay, and I'm not surprised at all. Almost intuitively, you would come up with these, to be quite honest with you. So if you have heard of these, and this isn't the first time you've been exposed to them, understand there's a reason you've heard of them before. There's a reason, even if they maybe haven't quite worked for you, they may work for someone else. And that in order for them to work, it does need to be practiced and taken somewhat seriously. The first couple of times I tried these when I was in practicum at Forest, I really struggled with it. All right, let's do this thing called guided imagery. Learn about it in class, and this is what we're supposed to do. So you guys want to make sure that you kind of agree and affiliate with it as well. You can still pick up on that. They will, I promise. Finally, pacing is another one of those intuitive activities that can approach the behavioral aspects of managing chronic pain. Pacing is pretty straightforward. It's built on the idea that when someone that's in pain feels good, they want to take advantage of it. So what they do is they engage in overactivity, which creates pain. So they got to rest. Whew. I feel good again, so let's do this. Let's go walk 4 more miles. And you're like, oh dear God, no, please. You walk to the end of the driveway or back. Don't be content with just that. Maybe in a couple more days, walk around the block. Maybe go out to the park one day and walk a little bit further. Do something and record it. Because I'm a big believer, and the science has shown that when you take the time to record what you're doing and you see progress, that you're more inclined to do it. You're more inclined to stick with it. Same goes with exercise, maybe overcoming an addiction of some kind, anything. Record it. The idea of pacing is that you do a little bit of activity that's reasonable. You determine what that is for yourself. You engage in some rest. You might do the activity a little bit more. Engage in some more rest. And then this next page actually is the final page, I'm sorry, is a little table that's associated with this exercise that gives you an illustration of this. The activity might be walking in this case, which you do for 3 minutes, and then you're going to rest for 5 minutes, and then you might walk for another 5 minutes, then rest for 10 minutes, and then walk for 7 minutes and rest 5 minutes. Whatever activity that they feel is reasonable at that point. If you're working with them hands-on, then you can encourage that. I think what makes this different probably from perhaps what you've been exposed to in the past is the recording aspect. Different personalities are going to respond differently to each of these interventions. I mentioned earlier that we can't assume that everything is going to work for everyone. So the more you know your patients, the more you even kind of know yourself a little bit and kind of what you respond to will help you pick out a couple of these. And by no means is this an exhaustive list of everything that is possible that you can possibly do to manage chronic pain. But they are some behavioral, emotional, and cognitive things that you can intervene with. If you have that type A patient who is methodical and likes to sit down and write things out or make lists, this might really appeal to them, because now they're going to be able to see the progress that they're making. Does anyone have any questions about this or the reasoning behind it? Pacing is intended to get you out of that, get that patient out of that cycle of stressing their body too much, which just makes it a harder job for people helping them. So in conclusion, I want to stress the fact that it's important that you affirm the pain. It's important that you help them understand that the pain may not ever totally go away, but that there are things in the control that they can do to take it back. You will continue to experience some of the negative feedback to some extent, even as they're learning. I wouldn't look at their negative feedback as an indication that they're not picking anything up or not trying, because there's something in behavioral science that we call extinction burst, and in fact their complaining may be exactly that. They're at the very end of complaining, and so they're just going to go ahead and do a bunch of it and get it over with, and before you know it, the next week you see them, they may not have anything negative to say. And that will be a tribute to your persistence as well as their persistence. and your willingness to kind of help them tackle it, or if you're experiencing pain yourself, to sit down and tackle it for yourself. Everything that I mentioned here is not meant to be a substitute for some of the other things. In fact, science shows that when the different professions collaborate, it's going to produce the best outcome for the patient. So maybe there is a need for pain at some times, for medication. My mother is actually on a lot of medication, and she came to the conclusion that she just couldn't do it anymore. She didn't want to shorten her lifespan. She wanted to be more lucid for conversations with me and her grandson. She wanted to get to a place where she wasn't reliant on it, so she could maybe go out and get a little part-time job or something, get some extra income. So she made that choice for herself, and I really respected that. And so I was able to share some things that she's been slowly practicing and becoming more adept at. And I'll be honest with you, that for me, not just as their son, but as someone that I care about people who have chronic pain, that for me is extremely rewarding. And I can only imagine it's the same for you, to see that improvement. So I hope you can take some of this into your toolbox, and it will help you and encourage you to stick with it. Appreciate your time. Are there any questions?